this is interesting. If I had a smartwatch, I might get some information after having the second cup.
Yeah, about your heart rate.
Smartwatches these days come with a variety of health detection options, from heart rate to oxygen, steps, sleep patterns, fall detection, and ECG capabilities. And everyone from Samsung to Fitbit to Apple and more are trying to one-up each other on these devices.
Apple just released the latest update for its watch that can detect potential hypertension in users.
Wow.
And with more on this, we're joined by our medical expert here on Connecting America, Dr. Payal Kohli, cardiologist and adjunct professor at Johns Hopkins and Duke University. Thanks for being here, doctor. We appreciate it this morning.
Good morning, guys. You're wearing your smartwatches?
I left mine at home, so I don't know how I'm doing. But my phone does track some stuff. It does definitely tracks my steps. How does this technology work, first of all?
You know, I'm really excited as a cardiologist about this technology and also about the concept of using everyday technology to screen people for diseases that are common. So we know that hypertension or high blood pressure, 1.3 billion people globally, and it's often a silent killer because it doesn't get diagnosed until it's too late. So what the watch does is it releases these green and red light, infrared light, and then it sees how the small blood vessels in the skin absorb that light and then reflects it back to the sensors. And then based on an algorithm, it looks at patterns to see, does your pattern match that of somebody with a normal blood pressure, or does it match somebody with a high blood pressure? And it monitors it passively for 30 days and gives you an alert if you trigger that blood pressure alarm.
So with this hypertension feature, what should someone do if you get an alert that your health might be at risk?
So I really want us to think about this technology almost as a alarm bell or a screening tool, but it's not a diagnostic tool. So this is not how we actually make the diagnosis of hypertension. So according to the American Heart Association, if you get an alarm, you need to go out and buy a blood pressure cuff, not one that sits on the wrist, but one that sits on the upper arm, and keep track of your blood pressure for at least 7 days, possibly longer, and talk to a healthcare provider about whether you actually have hypertension, because the technology is not going to pick up everyone with high blood pressure, and the algorithm, because it is an algorithm, may not work properly in some people, especially, for example, dark-skinned individuals, because it's using light technology. And so it hasn't necessarily been validated in people who have darker skin or people who already have pre-existing high blood pressure. We don't know how well the technology performs in those individuals.
You know, doctor, a lot of folks are going to be watching this, wanting to go purchase their first smartwatch. Can you tell me how these different devices or brands stack up against each other?
You know, we're doing pretty good overall. I would say Apple really has a lot of the algorithms. I, as a cardiologist, often use the ECG algorithm on my patients. And certainly this new hypertension algorithm was developed in over 100,000 people and then validated in about 2,000 more. Overall does pretty well at some of the basic things. Like you mentioned, I'm on my second cup of coffee, so it's probably doing a good job of my heart rate right now. It does a good job of step count. It does a good job of sleep wake, you know, what time we're sleeping, what time we're waking up. What it doesn't do a good job of is getting accurate numbers, because it's just a sensor. So I won't have data as to how high somebody's blood pressure is. I'll just know that it's high or it's not high. So it's more of a dichotomous response. And also it's really good about looking at trends over time rather than instantaneous readings. So I think more and more we're embracing these kind of monitoring devices, whether it's Fitbits, Apple Watches, or our rings, as a way to sort of screen people. But it's important to have the warning that it's not going to pick up every single person with disease.
Repeated warning, it's obviously a good idea to talk to a medical professional. Don't just rely on the device and say, oh, I'm fine, or there's something wrong, and start self-diagnosing.
That's exactly right. And if the device doesn't diagnose something, that doesn't mean you don't have it. So I would still encourage all of us to make sure we're seeing our doctors, make sure that we're doing home blood pressure monitoring, keeping an eye on our, you know, our cholesterol, our heart rate, all of those types of things. And don't think that this is a diagnostic quality device. Even though some of these, just like this hypertension technology, are FDA cleared, they're not medical devices. And so don't rely on the interpretation so much so that you don't go see a doctor if you're having concerning symptoms.
You know, Dr. Kohli, we were talking about this yesterday in our editorial meeting, and one of our producers was saying he purchased one for his father. And it meant so much for him to be able to see day-to-day information, keeping in touch. Again, we know that this does not substitute for a doctor, But do you see that? Do family members have a sense of peace and getting that data from loved ones they're caring for?
I think that's a great idea, and I would encourage a lot of people to do that, especially for their older parents, because it's really good at things like temperature tracking, for example. So if one of our loved ones is getting a urinary tract infection or some other type of infection, it can do a nice job of, making sure their temperature doesn't get too high and alerting you if something happens. They're even developing technologies where it looks at what's called a frailty score. How frail is the person? How active are they during the day? How much are they moving? How high risk are they for falling, all of these types of activities. So as a physician, I know that I'm relying more and more on this technology to bring people into the office.
Yeah.
Certainly our older patients who live alone or maybe have limited access to resources, I think it's a great way. And for many of us that have the older watch, they actually might be pushing a software update on a few of the older models to also develop this hypertension or high blood pressure feature. We know that 9 out of 10 of us take in too much salt, and high blood pressure is so common that I'm really, really excited as a cardiologist.
There's no salt on the table here, Dr. Kohli.
I consumed it all, that's why.
There is sugar, however.
Oh, I'm not a fan of sugar either.
Okay. Trish is trying to hurt us. Thank you, Dr. Kohli. We appreciate it.
Thank you so much.
Thank you.
And I love that our producer as he was telling us, just shared an idea with folks watching this that they can apply for their own lives. So good job, Manoj.
But when my kids start getting a device for me so they can monitor my health, I'm going to feel old.
That's another conversation.
It is important. I have an elderly dad. God bless him. He's 96 years old. He's doing great. But, there are times when you want to know exactly how he's doing. He's never alone at this point, but, you want to make sure he's okay. And I don't know that, I don't know that he would wear one of those devices, but it's something to think about.